I'm here with Will, and we're going to do a little bit of cosmetic dental bonding. He's got some decay on his two front teeth on his right side, the lateral and central incisors. You can see right there. They're chipped and they're decayed. So he's got some staining on the other teeth. Put a little topical anesthesia on again. We're going to use a little articaine, 4%, to get good anesthesia on him so he doesn't feel what we're doing. A lot of times, if there's not a lot of decay, we can do cosmetic bonding without any anesthesia. But in a case where there's, fairly deep decay, and especially by the gum line, it would be sensitive to do this without anesthesia. So we numbed him up, making sure he's numb, and he is. The first thing we're going to do is just remove the decay. Doing that now. I have Erin helping me here. Getting the decay all out of there. I'm using a skinny diamond to bevel everything. Gums are bleeding a little bit, so I'm going to put a little bit of Hemodent on the gums, and that'll stop the bleeding. We're going to isolate the teeth with a cotton roll and a clear matrix band. Put some etch on the tooth and wash that off. Put a little primer on there. A little bond. Put some bonding on the teeth, some composite. Here we're going to use both a hybrid and a microfill types of composites, and we're going to cure them with a light, LED light. Just make sure both sides are done. Now we're going to work on the front tooth, same idea, keeping everything isolated with a cotton roll, etch it, wash that off, going to light cure it. Going to use the composite again, bonding material, shape it carefully. Light cure that again. Just make sure everything is hardened with the light. Now we're going to shape the tooth and remove all the excess composite, the excess material, to make them look more uniform and blend in better. It's a skinny diamond now. Get some more of the detail in there. Make sure his bite is okay and closes down evenly. Gonna check the bite again, it's fine. I'm going to smooth everything down. I also like to take some of the stain off and smooth his other teeth as well. Get the inside also. Make sure everything is smooth. Will is doing fine, no problems. Starting to look pretty decent. Wipe everything off. Use a sandpaper strip just to make sure everything is smooth in between the teeth and that he can floss okay afterwards. It's looking pretty good there. Fine-tune things a little bit. This procedure took about 30 minutes. You have it kind of shortened here on the video. It's a pretty big improvement, I think. He was happy with it. That's the most important thing. Have him take a look at it.
Nice.
No more black.
Wow.
Looks good. I cleaned up some of the other ones.
Yeah. It's a huge difference.
Oh, yeah.
Nice.
He looks good. Much better than before. If you need your teeth treated, you think they don't look good, you're concerned about decay and your smile, with cosmetic dentistry, with bonding, a lot can be done. Your smile can be completely improved, and often in just a single visit. So that's a very typical result. Here we have a patient with discolored teeth. There's some decay and spacing, and so what we wanted to do was improve his smile with porcelain veneers, and that is the result. And he looks pretty good. Big difference from before. Here we have a patient again with some spacing in between his teeth, and he also has uneven gum lines, which can really distract the eye. So what we did was porcelain veneers to close the spaces and improve the color and size and shape of the teeth, and we raised the gum up, and that is the result. So he looks good. He looks good. That's a big improvement, I think. Here we have a patient that has some spacing in between his teeth, and so again we wanted to close the spaces down and improve the color and size and shape of the teeth, and we again used porcelain veneers to do that, and he has a much better smile there. Everything's closed. Looks good. Here we have a patient that has some yellow staining and discoloration of his teeth, so we're going to do some tooth whitening. Here we have a full face view of the patient, and you see the yellow discolored teeth, and we're going to use 15% carbamine peroxide, and we're going to have him use our at-home tooth whitening system. We got a pretty good result. His teeth are a lot whiter, and he looks good. Looks good. Here we have a woman that had multiple decayed and stained and broken teeth, and what we did here to improve her smile and also to remove the decay and protect her teeth is we did a combination of all porcelain crowns and porcelain veneers, and in 2 weeks we were able to get her like that, and she looks happy, and she was happy with that, and she looks great. So you can see with tooth whitening, we can do tooth shaping, porcelain veneers, porcelain crowns, gum lifts, and we can make a substantial difference in someone's smile. For more detailed scientific and medical information, please continue to watch this video. We'll put a little topical anesthesia in there. We'll give him a anterior superior alveolar nerve block with some articaine. That should numb the teeth to the canine from the right central lateral to the right canine. A little bit of bleeding we got around the gums, which can inhibit our ability to bond the teeth. So what we're going to do is go ahead and put a little hemodent around on the gums. Hemodent contains aluminum chloride. There's no epinephrine in it, so we don't have to worry about increasing his heart rate, and we just go ahead and get the bleeding to stop. Now we're going to use some etch. We'll be using a total etch technique here with a 40% orthophosphoric acid. I'll let that stay on for 10 to 15 seconds per tooth. What the etch does is it removes a smear layer, and it demineralizes the surface of the tooth or roughens it. That helps for the composite to adhere to the tooth. Now we're going to go ahead and put a primer on the tooth. The primer improves the chemical reactivity of the dentin in the tooth, and that makes the collagen fibers stick up. So we're going to go ahead and do that. Then we put a bonding agent, and the bonding agent bonds both to the dentin and the enamel. That's generally an unfilled resin. Now we're going to go ahead and put composite on the tooth. It's a tooth-colored filling. The composite is composed of bis GMA, inorganic particles like quartz, borosilicate glass, barium aluminum borofluoride, silicate glass, and highly dispersed silicon dioxide. We're going to go ahead and light cure that now. I'm using an LED light here. The LED light is a photo initiator, and what that does is it initiates a chemical reaction that hardens the material.